I would never get a root canal. You know, I would get all these teeth out that have a root canal ASAP, and I'd have a zirconia implant straight away. That's the kind of extreme thing that makes it to an algorithm, which is why dentists then suddenly thumbs down it and then say that what is this nonsense kind of thing. You are someone who talks about being holistic and talks about being biological, and just tell us if you think there is a difference between those two terms. Are they used interchangeably?
Even though I call myself a holistic dentist, I'm looking at the best dentistry is no dentistry and how I can work together to improve that. I would personally have a root canal rather than having a tooth out. I believe in endo and I believe in it. However, I will do everything I possibly can to avoid a root canal for our patients. I can do really great margins and all the rest of it. Patients don't give a damn. They want somebody that they can relate to, that is listening to them. And I think that's the biggest issue in dentistry at the moment. We don't have time and we don't listen to our patients. And I think actually spending the time to get to know them and finding out what motivates them, what are they interested in, why are they sitting in that chair today? Because there's a reason why they're sitting in that chair today.
In my career so far, I noticed holistic dentistry growing and becoming a thing, and I was intrigued. I was like, okay, this is interesting. And then recently, of course, we've had the rise of biological dentistry, and I was confused about the term biological and curious. And then I was really annoyed and upset by some of the stuff I saw online about anti-root canals and how everyone who had a root canals and they get cancer, and some really like extremist stuff in that regard. But I have to say one thing, their marketing is very interesting, but patients seem to really like the idea of it. Patients seem to be seeking out biological dentistry. There's something that they're telling the world that is very enticing for patients. So in this episode, I've got a real biological dentist. That sounds really funny when I say it, but it's Dr. James Goulnick, who is so much more than just a biological dentist. He's a holistic dentist, but he is a leader in every way. I identify him as one of my first ever mentors in dentistry. And you'll hear it in the main interview about how he was involved in my early time as a student, ex-president of the BACD, and his charity work and his previous books. And so I'm a big fan of Dr. James Goulnick, but it was interesting when he kind of went biological. And so I was intrigued and I thought, okay, 2 in 1, right? I get to interview one of my mentors and favorite people in dentistry and someone who actually identifies themselves as a biological and a holistic dentist. So it's a triple whammy, in fact. We get to find out so much from today's episode. What do these terms mean? How are they different? Are root canals dangerous? Does Dr. James Goulnick, an extremist biological dentist? Should we be removing our implants and having zirconia implants placed? Is this the future of dentistry? Well, actually, I'll tell you something. Some of it, I think, will be the future. And James really is a pioneer in every way. He talked about the sleep tests he does, which I do as well, but we're very few in numbers as general dentists doing sleep tests. He's doing saliva testing, which I'm not. He's doing blood testing, which I do for myself, but not for my patients. And nutritional coaching. That's really interesting, and that's much needed in our profession, right? So actually, what James would say is that biological dentistry is just really good dentistry, and holistic dentistry is just the future, because we need to incorporate the entire body into it. So whether you're just a dentist who saw the title and you're just intrigued as to what's going on in this biological holistic space, or if you want a genuine snapshot into the future of dentistry, then you've come to the right place. This episode you're going to absolutely love. And today's pearl is not a clinical one. It's a sentiment that I'm sharing with you, which I think just fits so well with this episode. The pearl is that I want everyone to remember that dentistry isn't just about fixing teeth. It's about improving health. You and I may not agree with every claim in biological dentistry, but you will struggle to disagree that a patient's diet, sleep, breathing, stress, and inflammation all influence oral health. Am I right? So the pearl is, my friends, stay curious, stay open-minded, but of course, stay critical and never stop asking better questions. And with that, my friends, let's now join the main interview. Dr. James Goulnick, it is an absolute pleasure to have you on the Protrusive podcast. You are an absolute hero of mine, a massive inspiration. From my dental student days, you did quite a few BDSA talks, right?
Yes.
And then I was like in maybe 3rd year, 4th year, then I heard you again in 5th year. Then I heard you again when I was like a DCT1 in a guy's hospital, and you came into the talk there. So you're a very, very active chap on the speaker circuit. And then I was just inspired every time. And I remember one time you did this lecture at BDSA, I think it was possibly in Newcastle. And you said, only about 5% of you are going to do what I'm going to tell you today. 95% probably won't do it. And you said very, very honest, that only about 5% of you will. So I made sure that I was in that 5%. And one of the things that you recommended, which for me was life-changing, I think, is you're the one who recommended to me, and I recommend it on the podcast all the time, is Strengths Finder 2.0 by Tom Rath. Yep. You're the one who got that in my hands. And that just changed my perspective on everything. And so that was brilliant. And then I read your book. And so you're an absolute inspiration. Everyone in Team Protrusive knows about you and how much you've contributed to my career. And not only are you just like, I'm kind of like doing like an intro for you here, but like, not only are you very well known in dentistry for all the right reasons and this, kicking sugar out and all these campaigns that you've done, but even amongst your patients, just last month, I saw a patient who used to be your patient, okay? But she left the practice that you're at because you left, right? And so you were no longer there. Yeah. And so she tried some other dentist and she's like, nope, it's not James. So there's no point commuting all the way from where I live to go to that clinic. She came to see me now, lovely lady, and she spoke very highly of you, and so did I. Okay. So there we are. Proof, actual proof that patients speak very highly of you as well. But James, look, you're such an interesting chap, so much experience in dentistry. So can you give us a introduction to yourself and how your career has evolved over the years?
Wow. Okay. Well, thank you. First of all, Jazz, thank you for inviting me on. I've known you since you were this high. And obviously spent lots of time with you on different things, and actually love to see how you grow and develop and picking all the things, and also the positivity that you extrude. I remember you helped us on Heart Your Smile right at the beginning, trying to get more positivity into dentistry. First of all, I love what I'm doing. I'm a clinical dentist still. I do 3 days a week treating people like a lot of you listening and watching are. So I'm actually clinical dentist to do that. So that's the one thing. And people say to me, like, you sold your business, why don't you retire when you're playing golf? One, I don't play golf. And two, I love what I'm doing too much. And I love giving back and teaching and getting people to get that 5% and making them think a little bit different about what they do, and they question it. So I'm a clinical dentist. Did house jobs, did oral surgery for 2 years, and then set up my own practice, which I sold 3 years ago now. So I've been in one clinic for 21 years. And I think the best bit about that is building a team from sort of 1 surgery to 8 surgery, to seeing that development, but also spending the time with those patients, because a lot of people move around quite regularly. They may only be in a practice for 2 years. All their dentistry works, because most dentistry works for 2 years, but actually seeing what happens further down the line. And actually what I really love is seeing my patients grow, develop, and hopefully not needing any dentistry as they go through, but also how I can make a difference to empower their life, reduce stress, how I can help them sleep better, how I can help them with their relationships and their diet and everything else. And I think what I'm hoping to talk about today is that staying in one practice, you get to see what works, what doesn't work, but realizing over the years that we were taught certain skills in dentistry. So I can cut a great cavity, I can do really great margins and do all the rest of it. Patients don't give a damn. They want somebody that they can relate to, that is listening to them. And I think that's the biggest issue in dentistry at the moment. We don't have time and we don't listen to our patients. And I think actually spending the time to get to know them and finding out what motivates them, what are they interested in, why are they sitting in that chair today, because there's a reason why they're sitting in that chair today, and trying to give them a quick win, as it were, fixing whatever the issue they've come with, but building that long-term relationship. So we set up Optimal Dental Health now 18 months ago. It's my second squat. And some people say at 56, like, you should be retiring and stopping. It's like, no, I'm enjoying it too much. It's good fun. I forgot how hard it is. So anyone listening who set up a squat, I really feel for you, because it is hard work, especially when I did it, obviously 22 years ago. Very different compliance, CQC, different levels of paperwork. So it's very different now, but actually it's very satisfying once you've done it all and then really helping our patients. So, and this clinic is very much focused towards patient. And we can talk a little bit later about holistic or biological dentistry and things like that. But I actually think this is what dentistry should be. It's all about listening to our patients. It's all about giving them a reason to be there, empowering them to make changes. And that's one thing we're not really talking enough about at dental school, is like behavioral change. We're there in our appointment, whether it's 30 minutes, 90 minutes, to actually make a difference to our patient, whether we fix their tooth, get them out of pain, make them look good for the wedding, stop their gums bleeding, reverse their diabetes, improve their sex life. Whatever we're doing in dentistry, we've got a short period of time to make that impact. But also, a lot of our patients don't really go and see the doctors very often. They go when they've got a problem and then they get back again in a few years' time. But we regularly see people. We've got benchmarks to see what their bleeding scores are. we can now start looking at blood tests and things like that, and actually how we can monitor people, encourage them, and make a bigger difference in their overall health journey. And that's the thing I've learned as I've gone along and realizing we've got certain tools in dentistry, but there's lots more we need to know about. We don't really know enough about nutrition. We don't really understand it. We're told that don't snack, maybe don't eat sugar, don't brush your teeth afterwards, but we don't get told about microbiome. We're not told about how the diseases in the mouth connect to the rest of the body. You're reading more about it, and our patients come in now and go, well, I've read this about Alzheimer's or cognitive decline. My family's got it. I'm worried about it. Can you do something about it? And interestingly, when I see patients now at the new clinic, people are coming to see me and I go, why are you coming to see me? Well, my dentist told me I need a root canal and I don't trust them. And I go, okay, so how long have you known your dentist for? And they're like, 10 years. It's like, okay, you've been going every 6-9 months for 10 years. They told you need a root canal and you don't trust them. Why is that? Well, I've seen this Instagram video about root canals and how it's really bad for me. And I've watched the Netflix documentary on root canals and I want to do something different. And I think when you have that conversation with a patient, it's really fascinating and starting to listen to them a little bit more. And I think conventional dentistry isn't doing that enough. Or I had a patient the week before who was saying, I asked my dentist, what is in that filling material? And they said, oh, it's a composite. And they said, well, isn't that got BPA? Oh, don't worry about BPA. And they just get on with it. They don't have that conversation. I think we should be proud of what we do, proud of the materials. Certain people want to know everything. So have all the lists of all the different constituents in the filling, have an alternative, have a BPA-free composite for the patients who are interested in it. Probably half the patients don't care. But the ones who do care start looking at it. And I feel that even though I call myself a holistic dentist, I'm looking at the best dentistry is no dentistry and how I can work together to improve that. But also I'm open to listening to them and saying, oh, my new patient consultations are in 90 minutes. And I'll listen to them, tell me all about their reactions and their allergies and all the rest of it. But do I do anything dentistry different? Maybe not. But what I'm doing is listening, and then I know every single consistent in all my filling materials. I give them options, and then I measure things. So if they're worried about, for example, mercury, I get patients who worry about mercury and things like that. It's like, okay, why are you worried? Okay, let's do a blood test and see. There's a thing called a tri test where you can do a blood, hair, and urine sample and look at the levels of methyl mercury in their system and see, has they got a high dose? So I see them and say, well, look, actually, we've done the blood test. It's all low. You have got metal fillings, but they're fine. We'll take some photographs, review them, and that's it. We don't need to go in and start doing it. And I think that's where some holistic dentistry gets in trouble, where they're taking out fillings that there's nothing clinically wrong with them just because the patient says, I don't want it in my mouth.
I mean, that's fantastic straight away, because that was one of the questions I had for you, which is those kind of patients that come in thinking, oh, my mercury is a cause, the mercury in my fillings is a cause of X, Y, and Z. But to have an objective test you can do to say, okay, it's unlikely to be cause of your fatigue or whatever, because actually there's not much circulating in your body. Therefore, in the clinical dentistry perspective, it does or it doesn't need replacing based on that merit rather than a perceived thing. So you're turning something subjective into objective. But whereas most dentists would probably be like, it's probably not doing anything at all without the testing element, but you bring that testing element, which is good.
Or they put the patient down and go, well, there's nothing wrong with mercury. I've got mercury in my mouth. And they just don't listen and don't engage. And it's like, for some people, and I've got patients who've had mercury in their mouth for 20 years, have no problems at all. They move house, they move into somewhere which has got some damp or some mold, and suddenly they're not sleeping as well. They've got some fatigue, they've got some sleep issues. And we start looking at it, and actually, that is one of the extra drivers that's causing inflammatory reaction in their body. So we can measure that either with a mercury test, or we can do a thing called CRP, which looks at levels of inflammation. But we can say, well, actually, these are the issues that we're going to work with. I can replace that filling. I will take photographs with radiographs. We give them all the usual consent of what it. I'm very careful when I take it out. So we use the SMART protocol where we use rubber dam. And basically, it's stuff that we are taught at dental school, rubber dam. But we're listening. We are doing other things like we're giving them an activated charcoal mouth rinse, first of all, which helps coat the mucosa. We're cleaning and being really careful to chunk the mercury out for them and making it. And then we're doing detox. So if they want to do high dose vitamin C afterwards, they want to drink 3 or 4 liters of water every day for 3 or 4 days. We're doing whatever we can to reduce the mercury risk when we take it out. and also to protect us as well at the same time. And then we're working on their symptoms as well. So it's like, okay, I've got markers of your mercury in the system. I'm looking at your overnight sleep tests. I'm looking at the CRP or blood results, and I'm not qualified to interpret all the blood results. I've looked at thousands of blood results and I know what I'm doing. However, even with a nutrition diploma, I'm not a doctor. So I will work with their GP, I'll work with a functional medicine person, but I'm going to look at everything. We've now got a custom GBT that we've trained highly, and they've got all our information plus all these tests. And we can say, well, look, these are the benchmarks. This is where your CRP, which is the level of information is at the moment. We're going to remove this infected tooth. We're going to replace this amalgam, and then we're going to retest in 8 weeks. Let's see what a difference is. And how do you feel afterwards? So we look at the markers, we see the results are improved, and they've got more energy, they're sleeping better. And it's like, okay, I helped that. It may be not the only cause of it, but that's one of the things. And if it's stressing the patient out and they're not sleeping well, we know that stress makes a big difference to the immune response and how everything else replies. So if we can reduce some of that stress by listening to them and actually doing some treatment that's evidence-based and as careful as possible, I think we're doing a win-win and we're helping our patients.
You've reminded me from all that, you reminded me of something that, again, you taught me probably 15, 16 years ago, which is this. When you're doing an oral cancer examination, you tell the patient, I'm yes. checking for oral cancer. Do you remember you speak about that in your lectures, right? But maybe you still do, right?
Yeah, I do.
Exactly. And it was just now you think about it, it's so obvious, right? Why would you do something without telling the patient? Because now the perception of the patient is completely different. Now they might change dentists, and the dentist who says, oh, I'm checking mouth cancer, they'd be like, wow, no one's ever done this. Well, they've had it before. In a similar way, when you're doing the mercury or the amalgam removal, you're using rubber dam, but you make away. We're using rubber dam so that it doesn't get in contact with your mucosa, okay? So you're just basically relaxing the patient. Patient's concerns are being addressed because A, you listen to them, but B, you are making that connection, and it's the power of words.
Yeah. We try and listen to them, we connect to them, but I always want to talk to them because I don't want them to be anxious while we're doing the treatment. They know when they're going to feel something, when they might not feel something, so we can go through that. But also, just the value of it. I want them to come out of there and go, wow, I really thought that was a good value because I learned all these things. Then we do a follow-up. We give them a whole sort of printed report with loads of photographs and everything else, and make them understand this is why we're doing it and this is how it's going to take the treatment. And I think the tricky bit at the moment in what's going on in dentistry, there's so many different tests. There's microbiome tests, there's this, there's that. Patients come in and go, I want an oral microbiome test. And they go, okay, well, why? Well, I've seen it on a YouTube video and I want this test to do it. Okay, what's it going to make a difference to treatment? And I think that's the thing, is that when I'm doing these tests, some of them are expensive, some aren't expensive. It's like, why will it make a difference to my treatment? Number one, will I choose a different avenue depending on the results? Or will it give me a benchmark to see, has my treatment made a difference and improved it? Or will it motivate the patient? Some people are happy to spend £300 an oral microbiome test because they've been told for years from their hygienist they need to floss and clean all the rest of it, but they've not really got involved with it. Maybe their grandmother has got dementia. They've read about oral microbiome and P. gingivalis and bacteria translocating to the brain, all these different things they've read about on different podcasts or whatever. And then they go, okay, will it affect me? And then seeing that microbiome test to see their high risk or low risk then motivates them to look after their mouth better. So for me, as a non-invasive thing, they're happy to do it and we can read the results. I think it's a win-win for everything. So I think it's a great tool that we can do as an add-on. However, I probably do maybe 5% of my patients get a microbiome test. So it's not a lot of patients are doing it, but it's a tool in my armamentarium that I have there to say, okay, I know you're worried about it. Why are you worried about it? What can we do about it? Can we measure? Can we make a difference to things as well? And just make people understand that. And I think in dentistry now, we need to, with obviously AI and all these different tools that our patients have got, they are putting their x-rays into AI. They're putting in their notes when they ask them for them. They're putting in their results and they're going to you, Jazz, I want to have this done because this, I want you to do this, this, and this. And you go, okay, well, why? Well, ChatGPT told me that's the best way to do it. And it's like, okay, we need to have some evidence to say, well, okay, this is not the best thing for you, or we need to build that relationship with the patient and say, okay, well, I agree with this and we're going to do this. I'm not so sure about this. Let's see your response to the first bit and then go from there.
I think the most important thing, James, and I think is what you follow, is if there's a test that can be done which may like not really change much, but it may reassure them, reduce their stress levels. But as long as it does no harm, right? It just makes sense that, you know, because that really shows that you listen to them and it's a test that can be done and you explain that, look, it's probably going to help, but it is available to you. And then they make an active choice. As long as there's the risk benefit analysis is very strongly in favor of, okay, there might be a huge benefit, but really there's no much risk or negative issue that can happen here.
But also we're not putting down conventional dentistry. Dentistry needs to be done, but we're just making people listen a bit more, look at the metrics that we can make a difference to somebody. And for something like Alzheimer's, the evidence is so strong now on sleep apnea, sleep disordered breathing, and how it can really make a big difference, and how we can diagnose that with a sleep consultant. So we can do overnight sleep tests, but we can see signs in the mouth, and every dentist can look at the signs in the mouth, tongue faceting, the sort of the linea alba, ask them a question about how they feel in the morning. Like I had a lady in this morning, actually, really interesting. She came in, she was 23, and we were just going through the normal questions that I normally ask. And after about 10 minutes, she goes, I'm just checking that this is a dental checkup, isn't it? No one's ever asked me about snacking before. Okay. So we were, let's start going through it. And when I examined her, she had 2 teeth that had interproximal caries, both unrestored teeth. And it's like, okay, now I know why you're asking me these questions, because that, and then we sent her off with a food diary to fill in what's going on, because you say, oh, my diet's really good, I don't really snack, and then we started asking what she had yesterday, and she had crisp for breakfast. I don't know how many people have crisp for breakfast, but she had crisp for breakfast. And then she's like, oh, I have dates, but they're good because it's good sugar, and they're all these different things, but people don't understand that and they don't put that link together. So I think after today, if people could just ask a few more questions, and there's like, how do you feel? How's your sleep in the morning? How do you feel? Refreshed or not? And some patients are not interested in it. Some will give you a whole history of what's been going on. Some will tell you things they haven't thought about telling you before. And it's our job as sort of dental detectives to put things together. And if you're somebody who is not interested in sleep dentistry or doesn't want to know, great. Well, get a relationship with somebody locally who does that for you. You can refer them patients, they can refer you patients, and just start connecting those dots, asking the questions. And you really get, one, a closer relationship with your patient, but also you get loyalty. As you said with the mouth cancer thing, you're telling them about this. They go to another dentist and they just say, what do you do to brush your teeth? And then they're sitting back on the chair within a minute. And it's like, okay, this feels weird. I haven't got a relationship with this person. I don't really know them. And suddenly they're intimately looking inside my mouth. And it's like, I don't really trust you. So it's like, okay, can we build a rapport? Can we find some connection with them and find some reasons that will motivate them to make change? Because that's what we're trying to do. They're coming to see us because they've got a problem. She came to see me this morning because she's got a bit of a toothache, which she's worried about whether she needs a root canal or not. So we go through all of these different things, but actually trying to get that connection with her, which is really, really important. And I like staying in the practices for a long time to see what works, what doesn't work, but also motivating the patients. And also people like you, when they're first into dentistry, it's like, okay, I want the right people in dentistry who love it because it's a great career. You've got so many different things you can move into, but also how we can work with our colleagues now. There's so much more evidence on oral microbiome, the connection between mouth health and diabetes and things like that. And there's a huge growth in type 2 diabetes, but actually we can have that conversation. We can do continuous glucose monitors. And I think it starts with you and your team. So you wear a continuous glucose monitor for 2 weeks. They were like 40 quid. You see how your body responds to different things and snacks and foods and things like that. It's okay, when I have that chocolate bar, this is what happens. And you can start talking to your patients about that things. And it's another tool that you can do to help them understand, actually, it's not just the teeth when they're having their chocolate bar. It is the HbA1c, which is the blood glucose control. It is all these different things that we can connect the dots and then have relationships with local GP practices and things that say, look, I can help your patients with pre-diabetes. I can work on their gum inflammation and try and reduce that and actually make their blood glucose control better. And again, it's evidence-based, and it gives another reason why it's not just a scale and polish. Because that's what patients think it. Oh, I'm just cleaning my teeth. I had somebody last week who's like, when I was to say, well, you need to see the hygienist for this reason. They said, but that's just cleaning my teeth. I can do that. I said, yes, but you're 32 and you haven't been doing it. Okay. And I can show you the evidence. There's the bleeding. I show them a big photo of the gums bleeding, and this is happening. And these are the risks. And your father's got diabetes, and you're worried about this, this, and this. So this is why we need to motivate you to do something about it and show you the right tools and oh, I get it now, and that's what I'm going to do. It's just trying to make it more holistic, but also more looking at the total body. And I think everyone should be connecting these dots more and more.
And like you said, the research is pointing more and more towards the links between cardiovascular system and Alzheimer's, diabetes, as you mentioned. So that's very true. And I think dental students nowadays are taught about this, but where we all fall down at the moment, and it might be different in 20 years' time, is I think what you're really at the pioneer of really nailing is the implementation of it, right? Because right now, prevention doesn't pay. And we look at the NHS contract, right? Prevention, how can someone make a living in a public funded dentistry, right? State dentistry from hey, let's talk about your health. Let's help you. There's no UDAs for doing a blood test. There's no UDAs for oral microbiome tests. Okay. So that's that, right? So that's why it's very difficult to implement in state funded dentistry. In private dentistry, even in private dentistry, right? It's like, okay, well, I think the biggest stumbling block is, we get that, okay, this is really important. But what you really set up your practice around is, how does this work with the patient journey? How do I connect this with the nutrition and stuff? So inspire us, James. Tell us about how the patient journey looks like and how you're actually able to implement a blood test. Do you take the blood? Do you have a phlebotomist on site? Do you have a nutritionist on site? You have a diploma in nutrition. I'm just very intrigued about how this can work in primary care.
So we've tried it and we failed more times than we've succeeded. When we first set up, we pulled this up and I thought, food first, I'm a big believer. I'm going to nutrition, all the rest of it. Pull this up, and we had people coming in going, "Is this a dental practice? Do you do teeth?" I'm not. I understand I got a problem, but I've got a hole in this tooth. Can you fix it? It's like, okay.
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive Guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through Protrusive.app. So our best deals and free trials are only on Protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
We've got it wrong. So we rechange it, optimal dental health is what it's called, but we're making it really focused on the mouth. We do dentistry, we do good evidence quality dentistry, but we look at the whole picture and we have a whole referral network. So I'm realizing that a lot of people won't pay for nutrition advice. They'll put it into ChatGPT or they'll get the rest of it. So how can we make it profitable, fun, and the patients want to do it? And we've done it through dentistry. So one of the things we've changed quite a lot of is our medical history. So we have a much more comprehensive medical history. We ask a lot more about diet, lifestyle, sleep, things like that. So to people, and people go, okay, this is a little bit different. So that first starts it off there. When the patient then comes through, we have a longer consultations, and that was easier than the squat because I had no one else to see. So it's like, okay, we can have a 2-hour consultation. That's fine. So actually getting feedback from the initial few patients who come through is like, okay, what do we do differently? We talk about what we're doing and the connections a lot. We do little things differently. So for example, I won't use Vaseline on a patient because it's petroleum jelly. It's got lots of different chemicals in. We use propolis. And we've got a lip balm that it's actually virtually the same price as Vaseline, but it doesn't have any chemicals in. So I tell the patient when I'm doing something. So are you allergic to any bees products or propolis? No. We're going to use this propolis lip balm, which is anti-inflammatory. So we do that because when we're pulling the lips around, you don't feel any soreness. Okay, that feels different. It's different there. We use filtered water on our machines. We don't use any mouthwash. We don't use any tablets because we're trying to reduce as much chemicals as we possibly can. So when the patient's rinsing out, we go, that's filtered water. So they go, okay, that's a bit different than that. So they start thinking about why it's slightly different. We're listening. And then we do, for me, I find a bleeding score is really good for motivating patients. So actually going around the whole mouth, giving them a score and saying, okay, this is where you are today. You're 25% bleeding. This is what we are. The target is 0. Most of our patients get to under 10% within 6 weeks. So we do that, and we do a thing called a 15-point health check. So we go through different things. We look at their sleep. We look at Malpathy score, which is like how open their airways are. And we take a pH test of their saliva. So they spit out, we test their pH and we look at it, and we're looking at something around 6.5. And the patients go, why are you doing that? Okay, well, we're just checking your risk factors for tooth decay and seeing how well your saliva remineralizes. So we're doing different things. And we give them at the end of that appointment this printed with, it's a PDF that we email to them, which is a 15-point health check, which scores them on various different metrics and what the next step is and what the next thing they need to do. So it might be something as simple as send me your blood results, because we always ask them about what toothpaste to use. Now, we've got sort of 2 categories. We've got people who say, whatever my partner buys or whatever my wife buys, they don't really know what they're using. Some of them is like whatever's cheapest on offer. And then other people go, I use this hydroxyapatite toothpaste, or I use this toothpaste. And you know then instantly where the conversation's going, because they're the people that are more interested in ingredients in products or what is good for them as much. So that's part of the journey. And then when they see the hygienist, we have phase contrast microscopes in all the hygiene rooms. So we actually take a little swab of the saliva on the deepest pocket, and we put it on the screen straight away live, and it shows them what is going on in their mouth. And we were first practiced in the UK to do it. We use Motic microscopes, phase contrast ones. And actually, it's a great motivator because you see all these wiggly things moving around. And first of all, then patients go, well, I'm going to get rid of all of them. And so, no, we need the bugs in our mouth to help break down food products to produce micronutrients and vitamins that we can't naturally produce. So there's like a balance between it all. But we show them what's going on, and we record that video and we send that video to them. And then once we've done hygiene treatment, we get them back in 8 weeks' time. We do another swab, and you see a real difference in the activity. And we can talk to them about what we're seeing on the screen, whether we see spirocretes, rods, different things we talk about. But majority of the time, it's just showing them, look how much stuff's going on there. When we do some treatment and you do your homework, look how it changes and how we can do that. So that is part of the journey. And depending on then how interested, if there's sleep problems, then we would say, look, I think we should do an overnight sleep test. And we have overnight sleep tests. We use product called WatchPack 1. It's not too expensive. So the patient can take it away and do that. Again, I can't diagnose that, but I would send that to a sleep physician. So we have these different things. We have the continuous glucose monitors if they're interested in changing that and they're pre-diabetic. Otherwise, it's a diet sheet that we go through. And then originally we had dietitians in the clinic and nutritionists in the clinic, sorry, but realized that actually it wasn't profitable for us. And most of the patients were happy to do it online. So now, if they're interested, we say, look, I'm going to send you in the email an instruction, a referral to a nutritionist. The first 15 minutes is free. They'll just have a discovery call, see if you can work together. If you're interested, great. If you're not, no problem. So there's no pressure on it. We don't make any money out of that. It's not a profit thing, but it is just part of the patient journey. And if they're interested, and again, it's apart from sort of retention of it, once they've seen us, then they've said, okay, these guys are looking at everything. I want to have a rounded picture. Then they start looking at that as well. So it's just seeing what works. We have a myofunctional therapist in the clinic. So if they're worried about airway breathing, sleep disordered breathing, things like that, we can send them and have a consultation there. So I'm there as a screening process to chat about it. Again, we have point of care testers. So we have a thing called Igloo, which is a fingerprint test. And we can do an HbA1c check, which is looking at blood glucose over the last 3 months. We can do a CRP check, which is looking at inflammation in the whole body. And then we do vitamin D tests. And we tend to do vitamin D for anyone we're taking a tooth out on or having any implant surgery, because loads of evidence shows if you're sub vitamin D level, you don't heal as well. And for certain implants, they're more likely to get rejected as well. So we do that in clinic and you get a result in 15 minutes. So that's something we can offer if the patients are interested. And we say, look, we'll write to your GP and this is what we suggest. But if you're having an issue getting blood tests, we can do them in the clinic. Or we also have a relationship with a company called Randox who have blood tests all over the country. We send them an email and the patients book in for it. So we've looked at all the friction points that could stop the patient from saying yes to treatment. But we want to get these markers for them to see where they are now, how we improve them. And again, some patients are not interested. They just want to come in, fix their tooth. We fix their tooth. We take loads of photographs. And then maybe next time they're interested in a little bit more thing. But for me, I want them to leave with more education, feeling like they've got value from that appointment, and also hopefully helping them towards their health span and working on their health journey. And I think that's something that fascinates me and the team about us. And it's just trying to get that journey to be profitable, but also interesting for the patient, and also working. And we have a GP here that started about 6 weeks ago, and we're now trying to see how we can incorporate that, because some people are saying, well, my GP doesn't listen to me, or they're not really that holistic about what they want to do, or they want to just put me on statins and I'm not so that interested about it. So, okay, let's see how that works. So we're testing these things and seeing what works and what doesn't. At the moment, the myofunctional therapy is working really well. And so the nutrition is online and that works well as well. So it's just seeing what works with your patient demographic, starting to talk about that. And we're sending our newsletters. We're talking about what does vitamin D mean? How does it make a difference to your oral health and your general health? And trying to educate our patients about how that can make an impact for them.
I think that's wonderful, James. I think what you set up is really a dream, because you've set up a way that we can talk about their nutrition. We can talk about their general health and still make it work in terms of a profitable business, which is not the most important thing, but it is oxygen, right? Without it, we can't do our dentistry. So it's important to do that. And the way you've implemented it with the patient's overall health in mind, I think is just genius. But it's something that it makes so much sense. When most dentists think of, okay, so holistic dentistry and biological dentistry with patients has this very strong messaging that patients hooks patients in, and a certain type of patient who's very into their health and slightly alternative, like really tunes in, and suddenly the algorithm is full of all this kind of stuff. Whereas as general dentists, what we see is the extreme stuff that's online, and extremism in any discipline is always going to stir trouble, right? And the extremist examples that we see is, hey, I would never get a root canal. I would get all these teeth out that have a root canal ASAP, and I'd have a zirconia implant straight away. And that's the kind of extreme thing that makes it to an algorithm, which is why dentists then suddenly a thumbs down it and then say that what is this nonsense kind of thing.
Yeah,
And so
yeah.
you are someone who talks about being holistic and talks about being biological, and just tell us if you think there is a difference between the two, those two terms, are they
Yes.
used interchangeably, and then thus what does it mean to you? So, and do you agree that that is an extremist view that is perhaps borderline dangerous? And then how do you want to change the landscape for holistic and biological dentistry?
Okay, great question. I mean, people post those sort of videos because they want likes, attention. They want to get that sort of discussion going. And I would personally have a root canal rather than having a tooth out. So as a dentist, I would definitely have a root canal. And we have a root canal dentist here in the clinic who does, she's got a special interest in endo. So first of all, I believe in endo and I believe in it. However, I will do everything I possibly can to avoid a root canal for our patients. So if we're worried about decay or we're worried about bruxism or anything that potentially could go on to, we'll do everything. We've got biodentine here. We'll do everything to try and save a tooth. And if a patient, we take a CBCT, and if there's no areas on the tooth and there's still some vitality, we'll do everything possible to avoid a root canal for a patient. However, then if it is needed because they've got pain, they've got swelling, there's a reason, we will do a root canal the best we can. But the important bit is root canals don't last forever. And the only way plain film x-rays do not tell us the whole the symptoms. So when somebody has got a root canal, we'll take a plain x-ray just to have a look at it and see. We'll look at symptoms, we'll check its TTP, all the rest of it. But for a new patient I've not seen before that's had a root canal for more than 2 years, I would like to see a cone beam, so a 3D x-ray to see what is going on. So I've got a benchmark of what's happening in the periapical region. Is the bone healthy? Is there an issue? Is there any cracks? So I would take that to have a look and see what is going on with the tooth. And then I'm going to monitor that tooth and see over time. Now, it is a dead tooth. And obviously we want to avoid any sort of dead parts of our body anyway. And for some patients, they have reactions to it. So I have some patients who've got chronic myalgia. They've got something going on in their body and they think it's because of their root canal. And for some people, we can use Articaine, which is a long-acting local anesthetic. We can actually do some blood markers to have a look at CRP and things like that. And actually, we can find that that tooth is causing an inflammatory reaction in their body. So they have a reaction. We can do a local anesthetic for a few hours. They notice difference in symptoms. Therefore, that tooth is an issue. Do we then retreat the tooth because it's that, or do we take it out? Some of the patients actually find out it's going to be more cost-effective just to take the tooth out rather than redoing a root canal. So that is an option, and that's an NHS option. They can choose to do that as well. And then if we're taking a tooth out or before we're taking a tooth out, we always have the discussion is, well, what are we going to do with it? Are we going to leave the gap? Are we looking at to restore it? Are we going to do an immediate implant? What sort of implant? And we have an implant surgeon here, and Andreas, he does titanium implants, but also zirconia or ceramic implants as well. So he does both options. And for some patients who have lots of reactions to metals, they're the sort of ones that can't wear jewelry or have reactions to different things, and they're really adamant they want metal-free dentistry. So again, we can do a test called the ELISA test, which actually looks at reactivity to titanium and titanium oxides and different alloys of titanium, and actually can show they have got a reaction to it and they should avoid it. Other people say, look, I just want a metal-free option and we're going to do a ceramic or something else. And again, if you're doing a ceramic implant, one of the key bits is vitamin D level has to be above 60 nanomoles per liter. So again, we would check the vitamin D and we would then do a ceramic implant if that's something they would choose to do. But a lot of the time they come in off the internet and they've said, I want a ceramic implant because they want the root canal out. When we've done a CBCT, we find nothing wrong with it. They've got no symptoms. There's no issues, and say, look, we've got a scan now. It looks healthy to me. Your blood markers are all normal. We're going to monitor it. We're going to take another scan in 2 to 3 years' time. And that's enough to just calm them down and make them realize that actually they don't want to do it. Other times they come in and go, well, we need this. And we say, well, ceramic implant's going to be £3,500. They go, wow. And I said, well, the titanium one is £2,500. So it's £1,000 cheap. You know what? I want this tooth out because I don't like it, but let's have a titanium implant. So in a way, the discussion helps us because we get people in who are concerned about it. We give them the evidence and say, well, we do titanium and ceramic. And if you're looking at pure biological dentistry, they're completely metal-free. They don't use metals in anything. So that's why I'm a little bit of a hybrid. So I'm a conventional dentistry. I do conventional dentistry. Holistic dentistry to me means I'm doing dentistry with a minimum amount of harm, looking at the materials you're using and using a material that's got the least number of chemicals specifically for that patient. So we get patients that get reactions to adrenaline. So we use adrenaline-free anesthetic. We get patients who don't want BPA. So we use BPA-free composites. We've got patients who don't want metals in the mouth. We don't do amalgam anyway, but we say, well, actually, we're going to do a ceramic restoration. So we're listening to them. And for me, holistic dentistry is like, okay, when we're using prophy paste, can we use prophy paste that's got least number of chemicals in, no additives, preservatives? Can we use, instead of the mouthwash with artificial sweeteners in, maybe somebody has a reaction to one of the sweeteners. So let's just use filtered water. So that, for me, that's holistic dentistry. We're looking at the whole patient journey. Can we use air filtration systems in the surgery so we can reduce as much pollen as possible and things like that? Can we do these things? So that's me. That's why I think holistic dentistry. Biological dentistry is taking it a little bit further and seeing how we can work with the body and try and reverse things like diabetes, Alzheimer's, things like that. Can we take out metals in the mouth? Can we look at the occlusion and say, well, actually, why are you bruxing? And some people are clenching and grinding because they've got ferritin levels are too low. So we do blood tests and we can see that their ferritin levels are low. We're going to write to their GP. They're going to work on working on their diet or supplements. And actually, they're not then grinding as much because their ferritin levels back to normal. So can we look at root causes? So biological dentistry to me is looking at root causes, looking at the whole patient in a different view. Some pure biological dentists don't believe in root canals, so they'll just take everything out. They don't believe in any titanium implants. And again, I've got patients, because I've been doing this for 30 years, that when I first started, I did my own implants. I don't do them anymore, but I've placed implants that are still there made of titanium. I'm not going to take them out. If there's an issue and I can prove that they've got a titanium allergy or reaction, or there's an issue, then yes, we'll look at alternatives, but I'm not going to go down that route. So I think that's the sort of difference from my point of view. I think all dentistry should be holistic. Biological is then more further training. So I've got a functional nutrition diploma. I'm just about to qualify in 2 weeks. So that's my training. I've then worked with the Institute of Functional Medicine as well. I'm doing functional dentistry training as well. I've worked with Dr. Dome in Germany on the different diets and nutrition sides of things and looking at ceramic implants as well. But looking at the whole patient picture, listening to the whole thing and not being really fixated at, right, you're not having a root canal, you're not having this. Because we know certain treatments work better in some patients. So if you've had that conversation, you've got the testing, you can then look at these different things and say, well, actually, root canal is not the ideal thing, but you're 21, we're going to do a root canal, we're going to monitor every 2 to 3 years and potentially look at replacing it with an implant in 5 to 10 years' time. But who knows what the technology is in 5 to 10 years' time. So what would you do for your friends and family? I would definitely have a root canal.
But going back to the extremist view, like you said, the pure biological dentist doesn't believe in root canal, would actually, from what I've seen on social media, would actively recommend asymptomatic root canal, taking them out. See, there comes a point where we have the accepted evidence base in dentistry, and some things are okay. There's a grey area, but this is very much, I don't know how to put it without offending these people, but this is battery. This is obviously, maybe they're getting consent, obviously, but this is not founded on good science, and so that for me is a dangerous precedent.
Yeah, but you can test blood markers to see, is a root canal, is it potentially causing inflammatory response in that person? So you can do testing. You can open up the tooth.
Is that CRP? Is that CRP? Because CRP, see, the inflammation could be coming from somewhere else.
Yes, yeah. You don't know where it's coming from, but there are more and more testing where you can actually take, if there is a pocket in there, so you can actually take a pocket, you can send it off for an oral microbiome swab of that pocket. So you can put a paper point in the pocket of that tooth and see, is there Fusobacterium in there? Is there something else going on there? You can open up the root canal and flush it out and then see what is actually in there as well. You can numb the area up and see, does the patient's symptoms change when you make the body realize it's not in there. But I personally, if I've got no proof that tooth is a problem, I will not take it out. Now, obviously, there are some dentists that will take it out and say, well, that's it. But then it's like, what are you going to replace it with? And then are they taking it out just because they're getting paid for it? And if they're doing that, then that's something I'm not happy with. So I think it's looking at the evidence, getting good records, following up what is happening with their body and see what's going on, working with their physician. But for me, taking out a root tree tooth that has no pericarpal areas, nothing on the CBCT, no signs of any systemic links, I won't do it. I'll say to the patient, you know what, it looks clinically sound to me. I don't think this is the cause of your symptoms. I'm very happy to monitor it and review it and see what's happening in the future, but I'm not going to take that tooth out. There'll be somebody that will be taking the tooth out. That's fine. Let them deal with it and let them deal with the consequence. But for me, I want to sleep well at night. I don't care what you've consented somebody to. If they don't fully understand it, then if you sit with a group of your peers and say, well, actually, you took out a tooth that I would have perfectly happily kept it, then I think that is negligent in my eyes as well. But again, that is the conversation. But I think in a way, it's good for whole of dentistry that we're having this conversation, because we're looking at why we do certain things. Why are we doing this thing? Okay, we do it because we do it. It's like we used to, I remember at dental school, whenever we had a sticky fissure, we would stick a probe in it. It was still sticky fissure. Let's put a restoration, because our restoration is better than the body. Now we're realizing that actually we can reverse these decays. We can monitor them. We shouldn't be sticking the probes in them, but that's how dentistry has changed. And I think there's more and more going on with these materials that can actually help regenerate pulp, whether it's biodentine. There's lots of other MTMA type products. Where it's actually, if we've got exposed, can we try with the patient, if they've got the right diet, if they're looking at anti-inflammatory, if they're looking at sort of curcumin and all these other natural products they could use, can we try and say, well, look, I'm very happy to do a pulpotomy here. This is what the fee is. This is what the evidence is on. It may work, it may not. If it doesn't work, you're going to need a root canal, and this is what the fee is. Would you like me to try? And I guarantee the patients are going to want to try. And if it doesn't work, you say, well, I've given you the consent. I tried it. It didn't work. What harm have I done? Okay, I've maybe delayed your having a root canal for a few weeks or a few months, but I'm monitoring it. Maybe I've charged you for the pulpotomy or whatever for a few £100, but we tried to try and save it. And I think that is something that I would want to do in my mouth. And I think you give the patient the opportunity to do something about it.
Excellent. Now, I've got a left field question. It's not too left field, but with your nutrition, sort of diploma, I would love to know what kind of diet do you follow? What kind of what do you eat?
Mediterranean diet. Mediterranean diet's the most evidence-based. I love it, and I think I say to my patients that you've got to enjoy food first. I don't care. You can eat a salad every single day. It's brilliant for you, but if you don't enjoy it and you're miserable all day long, fine. So for me, I've got to enjoy it. It's got to be food that gives me energy and nourishes me, so it makes me feel great. So like, I will go out for a Chinese meal probably once a month, once every 2 months or something, and I feel rubbish afterwards. I feel really lethargic and I feel really dehydrated, and I'm drinking loads of water, and I know they've got loads of MSG and all these other things. I do it because I like it, and my family likes to have a Chinese meal, so I do it, but I do it occasionally, and I know how I feel afterwards. And I think that's the thing for me, is like 80-20 rule. 80% of the time I'm eating stuff that's nutritious, that I enjoy, that's giving me energy. And then 20% of the time, I know the Chinese meal, or I know when I'm having a cake. So my wife loves baking. So we have lots of birthdays, and when we have a birthday, we always reduce the sugar by like 50% when she's making it. But if you don't put the sugar in, you don't get the texture. It doesn't work as well for baking. So I understand. I've written kick sugar. People say you can't have sugar, but I know I'm having it when I'm having it, and I'm having it rarely. And that's it. So I think that's the big thing for me, is like, enjoy the food. I take certain supplements just because I've tested all my blood works. I know what works for me. I do a vitamin D3 and K2 spray. I take creatine, which is really good for brain health, cognition, and keeping muscle as we get older. And I do omega-3s, so do fish oils, just because even though I eat oily fish twice a week, again, I want to keep that. Apart from that, don't take anything else. And when I get patients who come in who have a whole list of these supplements, they go, I'm taking this because of Huberman, taking this because of Tiff Qureshi, I'm taking this because of this person, I'm taking all these different things. Like, okay, well, have you tested it? Are you absorbing these things? Are you just peeing them out? Are you just taking expensive things? We really want to get all our energy and our nutrition and our vitamins and minerals from our food. We know that unless you're having organic stuff and the soil is not as mineral dense as it used to be, our food has changed a lot depending where we're, countries and things like that. So therefore, we're not absorbing a lot of these things. So I would encourage anyone listening, get some blood tests done, see where you are at the moment, see what you need to supplement, depending on what your diet is. And again, then working on how you feel, your energy, your sleep, and hopefully no tooth decay.
That's perfect. And I totally believe in regular blood testing. It reveals a lot about you and then allows you to constantly make changes, positive changes in your life and taking an interest in your health. What's more important than that? James, thanks for a gripping episode. I really appreciate you talking so candidly and honestly about your initial failures in setting up and how you've evolved. And it's constant evolution, your interests and your mission to incorporate a holistic nature, a holistic style of dentistry, and talking about some of the controversial biological dentistry stuff. Tell us, how can we learn more from you? Any education that you recommend? Any way that we can connect with you? And what's the next step?
Yeah, so I mean, I think I love LinkedIn. I'm old school. So if you're on LinkedIn, please send me a LinkedIn request if you haven't connected with me. My email, I think Jazz will happily share it with you. But if anyone wants to connect with me, you can go on to optimaldentalhealth.co.uk and email me through there as well. We have a monthly newsletter for practitioners if anyone's interested in seeing different things. I regularly talk on the non-dental circuit as well as dental circuit because I actually love speaking to longevity people, functional medicine doctors, and getting them to realize the importance of our mouth and then networking with a local dentist. So yeah, love to do all of that. And we regularly have people come in and shadow us as well. And there's so many different courses out there. So yeah, drop me a message. I'm very happy to sort of tell you what course might work best for you. But yeah, keep learning, keep developing, and work on you and your team first before you start implementing it with your patients.
That's a great tip. Do it on your close team and really get iron out all the issues that could happen in that flow before you then incorporate to your patients, and understand the why and what happens when this result happens, and having a workflow for everything. And I think you've talked very well about that. So James, it's an absolute honor to have you on as someone I see as a mentor, a hero, a massive inspiration. Thanks so much for everything you do in dentistry on a huge level, right? You've made a positive, really positive influence on our profession for the better. So thank you so much from all of us, and I appreciate your time.
Brilliant, Jazz. Thanks so much. Lovely chatting to you, and see you soon.
See you soon, absolutely. So here's something I think you're really going to like. We've all had that patient, the one who sits down and says, I heard my root canals could be causing systemic illness. Can we remove them? Or can we please take out all my amalgam fillings? And in the moment, it's hard to know exactly what to say sometimes. So we put together a free 4-page toolkit. There's a screening checklist, a nice simple filter for whether a test is actually worth doing, and my favorite, the conversation scripts, the actual phrasing for those tough questions, what to try, what to steer clear of. Go download it for free. It's at protrusive.co.uk/biological. Again, it's at protrusive.co.uk/biological. Well, there we have it, guys. Thank you so much for listening again, all the way to the end with Dr. James Goulney. Isn't he just a brilliant man? James, thanks again for inspiring me in my career. So now we know what biological and holistic dentistry is all about when it's done well, like James does it. Hope this episode's inspired you to think a little bit different, think about the mouth-body connection, or maybe some ways that you can change your practice. Because look, it is the future. All these kind of tests and involving nutrition and general overall well-being into your dentistry is not only the right answer, it is the inevitable future of dentistry. I'm hoping this episode has given you something to think about, some actions, or something a bit more to read about, learn more about. Now, if you are a Protrusive member on the Protrusive Guidance app, scroll down, answer the questions, and our CPD Queen Marie will send you your certificate if you get 80%. We have 7,000 members on our Protrusive Guidance app, home of the nicest and geekiest dentists in the world. Everything we do here at Protrusive is for you guys. It's about making dentistry tangible, it's about making education clearer, and just making our lives easier. Head over to your browser app and type in www.protrusive.app, make a free account. You can then always use your login credentials on iOS and Android, and you can see what's brought 7,000 dentists connected in one place. As always, I've got a few bits and bobs for you to click onto in the show notes, and you can also connect with Dr. James Goulney on LinkedIn. Thanks for staying curious all the way to the end. I'll catch you same time, same place next week. Bye for now.